Hey guys, Dr. Carver here coming at you with another quick video. Today we're going to talk about muscle spasms and the two most common causes we see in our clinic. So muscle spasms are extremely common, and in most cases they're not really considered a medical emergency, but when they're severe they cause intense pain and literally will make you drop to the ground. It can feel like a knife stabbing you. But as common as they are, a lot of people really don't understand exactly what a muscle spasm is or why it happens. So here's the deal. Spasms can happen for a variety of reasons, but in my office, we usually see them either from an injury or an instability, okay? Now, minor injuries are very simple. You overdo it at the gym, you pull a muscle, and they respond by tightening down. It's your body's way of limiting their motion to protect themselves. With these, you just need to rest and let those muscles relax, and the pain gets better. Obviously, with a more serious injury like a fall or a car accident, you want to get checked out and make sure you don't have any major problems like fractures or soft tissue damage. But these larger injuries often can cause instability, and instabilities are a little more tricky. In this case, the muscle spasm is a symptom of an underlying condition. Now, when I say instability, I mean anything that changes a normal joint function, so arthritis, disc bulge, or if the injury is bad enough to cause a change in the normal structure. Basically anything that makes a joint move abnormally. So in this scenario, the muscle spasms will never really go away until the underlying instability has been addressed. This is why your painkillers or muscle relaxers may give you some short-term relief, but they'll usually come back because they're not a solution to the mechanical problem. So people with chronic instability and chronic muscle spasms will always feel a little tightness in their muscle, but a few times a year it will flare up and cause a lot of pain. It's usually a pattern for them. They get a flare up, it gets better, then it comes back, and so forth. This is usually because they have an instability somewhere that isn't being addressed. So muscles will not spasm without a reason, all right? They can only do what your brain tells them to do. So if you have an unstable joint, your brain is going to send a signal to that muscle making it contract. It's your body's natural splint, but it can cause big pain. And in a lot of cases, the only way to make it stop is to fix that underlying condition. Luckily, chiropractors are great at that. I'm going to leave a link to a 2005 study where they actually monitored muscle activity with an EMG before and after a chiropractic treatment. What they found was in 24 of the 31 sites they monitored, there was at least a 25% decrease in muscle activity. Pretty amazing results. So if you're having muscle spasms, get to your chiropractor. As always, if you find this helpful, show us some love, hit that heart button, hit that wow emoji. If you know someone who has these spasms, share this video. We're here to help and we're available to answer any questions. So please don't hesitate to give us a call anytime or send us an email. Have a great day. God bless.